and very impressive presentation. So my name is Sultan Minto. I work as an operation manager for the Malaria Elimination Task Force for SMRU on the time on the borders. So I'm very excited. So today's topic is I would like to share with you all the ground situation of malaria like in Eastern Myanmar region. So just a bit background about our work. Our Malaria Elimination Task Force, as some of you may know, it was initiated back in 2014 with specific aims to combat, the emergence and spread of artemisinin-resistant malaria in this region, as you can see in the map. So basically, since we began in 2014 to 2024, we have established a network of more than 1,300 malaria posts. So as you can see in this map, not sure if we can, so here, so each dot represents the villages that we have malaria post. So just a bit background about where we are. This is current state in Eastern Burma region. We cover like 4 different townships, and this is the population coverage that we have. For our key intervention, there are a number of key interventions that we do with METF. So I will not go through all of them because of the time limitation. So I will highlight some of them, which are some of the speakers already mentioned about the importance of community engagement. And also, we also do mapping, and of course, as an operation manager, I have to oversee a network of malaria posts across the targeted areas. So right now we have more than 590 malaria posts in our network. So basically, what does it mean by malaria post? We call it malaria post. So we train the community in like conflict areas, in very hard to reach areas, to be able to provide early diagnosis and treatment. So we also do like a malaria surveillance. So basically what it means is that we gather the malaria data from the malaria post on like a weekly basis. So we get information on a weekly basis and try to analyze these data and see what action needs to be taken. So yeah, these are the key interventions that we have. So for this specific sharing or updating all of you, so I mainly utilize our malaria data. We call it malaria surveillance data that I collected from across all these malaria posts. And also this, I think one thing that I would like to highlight here is that this increases in malaria cases in Eastern Myanmar is not just a concern for the population. In Myanmar is also a concern for the public, and in Thailand said, because we share a long a borderline. So we also have collaborative efforts between SMRU, RRD, and the Ministry of Public Health in monitoring malaria trend, for effective allocations of resources and targeted interventions. So this bar chart gives you an ideas of what is going on with the malaria cases since we began back in 2014 until 2023. So one point that I want to highlight here is that by 2020, we almost we reached to the nearly elimination point for PF, falciparum malaria. While it increases after 2021, 2022, and 2023, it significantly increases. So this line graph shows you what is going on per 1,000 populations. So based on our data, just quick background about what is going on with Myanmar right now. I think some of you might be new to what is happening in Myanmar as well. So in Myanmar, the COVID-19 arrived in Myanmar on March 25th, 2020, and the political unrest, the military coup took place in like February 1st, 2021. So tomorrow is gonna be our 3rd year anniversary, which is quite sad at the same time with the military coup. So this, as you can see here, before COVID-19 and the coup, we almost raised to, the elimination threshold for perseverance, which is 0.4 per 1,000 population. So as you can see, it significantly rises following the military coup 2021, 2022, it reached to 30.6 per 1,000 populations. So for the virus, the trend between virus and perseverance are quite different, as the virus significantly rises following the military coup. One explanation is that because, as you all know, the nature of virus is the latent nature of the parasite that can hide in liver, and of course there might be other unknown factors that we don't know yet for these significant increases. For this one, I would like to show you what is happening between the age groups. So for the age groups, as you can see, the red one represent less than 5 years old, the orange 5 to 15, and the black one represent over 50 years old, the adult. So what we see here is that the age distribution across our targeted areas are not homogeneous, so in population. But what we observe is that in some villages, the cluster, the incidence of cases for virus is higher in children than adults. So in summary, so as I don't have a lot of time, so our campaign against falciparum was very successful. Though we stay, there were some remaining PF cases in the northern part of Korean state, but after the coup, the cases increased significantly. So again, just one thing to highlight here is that for our initiative, our campaign, for virus, it was not really, it was not in our targeted, programs, and also, it continued to remain endemic in our part of the world, our targeted areas, and there is a significant increases in the cases for, in the last 3 to 4 years, and of course, the causes of all these, increases are probably very, multifactional. So maybe it's because of the COVID pandemic, the political instability, and the violence that drive huge amount of population displacement, which is already in very hard to reach areas. And also, this also have disrupted, our healthcare service in the area, as well as our supply changes. So these all may combine, and also there might be also other unknown factors that we don't know yet that need to be studied. So, and of course, this whole situation in terms of the resurgence of malaria is a concern for the region and also beyond, because it can not only fuel resistance in falciparum, it could also be associated with other communicable diseases that we are concerned about. So this is basically the end of my talk. I hope I don't run out of the time. So this is my reference, and of course thanks to all the community, as we are really grounded in the community, and all the partners and the vendors and all our teams. Thank you very much.
Thank you. I think we'll allow one question.
ได้มาโอเคได้
Thank you for the presentation. I would have two questions. The first one is about the type of occupation for those malaria patients. What's the characteristic of those cases? And the second one is about Is there any different system of monitoring or follow-up for patients who receive the premaquine